The oral cavity hosts a diverse community of bacteria, both beneficial and harmful. Some oral bacteria contribute to maintaining a healthy oral environment. Poor oral hygiene can lead to an overgrowth of harmful bacteria. Harmful bacteria contribute to the formation of plaque on teeth. Plaque buildup and unchecked bacterial growth can result in gum disease. Plaque accumulation irritates the gums. This irritation leads to gum inflammation, known as gingivitis. Gingivitis represents the initial stage of gum disease. Typical signs of gingivitis include redness of the gums. Swelling and bleeding are also common indicators of gingivitis. Untreated gingivitis can escalate into periodontitis. Periodontitis is a more advanced and severe form of gum disease. In periodontitis, the gums begin to recede or pull away from the teeth. This recession leads to the formation of infected pockets between the teeth and gums. These pockets harbor bacteria and debris, exacerbating the infection. This process can cause significant damage to the soft tissues and bones supporting the teeth. Periodontitis can cause damage to gum tissue. Damaged gum tissue allows bacteria to enter the bloodstream. Inflammatory byproducts also enter the bloodstream through damaged tissue. The presence of bacteria and byproducts in the blood leads to systemic inflammation. Systemic inflammation affects the entire body, not just the oral cavity. The immune system initiates an inflammatory response when oral bacteria enter the bloodstream. This response involves the release of inflammatory substances to combat the bacteria. Key inflammatory substances released include C-reactive protein, CRP. Cytokines are also released as part of the inflammatory response. Chronic inflammation can damage the inner lining of blood vessels. Damage to the inner lining promotes plaque buildup, known as atherosclerosis. Atherosclerosis is the accumulation of plaque within the arteries. Plaque buildup increases the risk of blood clot formation. Coronary artery disease, CAD, is often caused by atherosclerosis in the coronary arteries. Atherosclerosis leads to a reduction in blood flow to the heart muscle. Reduced blood flow can manifest as chest pain, also known as angina. In severe cases, CAD can result in a heart attack due to complete blockage of blood flow. Stroke risk is significantly elevated by the formation of blood clots. Inflammation within blood vessels contributes to clot formation. Plaque buildup in arteries also promotes blood clot development. These clots can detach and travel through the bloodstream to the brain. Upon reaching the brain, clots can obstruct blood flow. This blockage deprives brain tissue of oxygen, resulting in a stroke. Endocarditis is a serious infection affecting the inner lining of the heart. In rare instances, oral bacteria can enter the bloodstream. These bacteria may then infect the heart valves. This infection leads to endocarditis, posing a significant health risk. Poor oral health can trigger inflammatory responses within the body. These inflammatory processes can negatively impact the cardiovascular system. Specifically, existing cardiovascular conditions can be worsened by oral health issues. Hypertension, also known as high blood pressure, is one such condition. Heart failure, a condition where the heart cannot pump blood efficiently, can also be exacerbated. Regular oral hygiene practices, such as brushing, are essential for maintaining dental health. Flossing aids in removing plaque from areas that brushing cannot reach. Effective plaque removal prevents the development of gum disease. Reducing gum disease lowers the risk of bacteria entering the bloodstream. Professional dental cleanings are essential for maintaining optimal oral health. These cleanings effectively remove hardened plaque, also known as tartar. Tartar removal is crucial because it cannot be achieved through regular brushing alone. Professional cleanings also address early indicators of gum disease. By removing tartar and addressing gum disease, professional cleanings minimize the risk of systemic inflammation. An anti-inflammatory diet focuses on consuming foods that help reduce inflammation in the body. This diet is typically rich in fruits and vegetables, which are high in antioxidants and other beneficial compounds. Omega-3 fatty acids, found in fish and flax seeds, are also a key component due to their anti-inflammatory properties. By reducing overall inflammation, this diet can help alleviate inflammation caused by oral bacteria. Therefore, an anti-inflammatory diet supports overall health, including oral health, by combating inflammation. Regular dental checkups are crucial for maintaining good oral health. These checkups enable early detection of potential oral health issues by dentists. Early detection allows for timely treatment, preventing the progression of minor issues into severe conditions. Maintaining oral health can contribute to overall health, including heart health. Managing cardiovascular risk factors is crucial for heart health. Key risk factors include high blood pressure and high cholesterol. Smoking is another significant cardiovascular risk factor to control. Controlling these factors can mitigate the impact of poor oral health on the heart. Good oral health is an integral part of preventing heart disease. Maintaining oral hygiene contributes to overall well-being. Regular dental care is essential for preventing heart disease. A healthy lifestyle and risk factor management are important for oral and cardiovascular health.